Doctors of Reddit, what are the dead giveaway signs that someone is faking? I went to emergency once with intense chest pain. The young, new doctor I saw first listened to my chest and immediately concluded I had pericarditis, but the supervising doctor decided I was faking it for drugs for some reason. The next morning I woke up to a psychologist in my room asking all sorts of random shit when an orderly interrupted because the ultrasound guy was in and wanted to see me first thing. I think after talking to the first doc I saw, turns out I had pericarditis and myocarditis, and the dude wheeled me out himself and told them, order an ambulance to take me to a hospital with a cardiac clinic. Obligatory, nodded doctor. But I got a call from my son's school nurse when he was in 2nd grade. And the conversation went like this. Nurse, sounding upbeat and cheerful, says, your son wants to tell you his terrible news. Son gets on the phone. Says, hi mom. I cut my finger off. I ask him, where is your finger now? Quote, son, I put it back on. I said, can I talk to the nurse? Quote, nurse gets on the phone again. Says, sounds serious. Right. I asked, does he have a substitute teacher today? Ah, yes. I told the nurse to let him know I will take him to the hospital for a shot for his finger. To which he says, I think it's okay. I glued it on really good. Nurse kept him in the office for a bit to talk about scary changes in the classroom. Monsieur, the inverse of this question. What can someone do if they are not faking it but for whatever reason they have multiple doctors insist they're faking it, but by never telling the patient they're faking it, nothing is ever resolved and it drags on for months and months. I am in the middle of being treated like I'm faking and it's really frustrating. I had a tool slip at work and hit me in the eye and forehead. Knocked me out for a second and I lost sight in my eye. An hour later I started getting my sight back, but it hasn't fully come back. It's been months now. 2 things I got diagnosed with were ocular migraines, and vitreous detachment, and a concussion. But none of those things explain why my vision is still blurry in my right eye. Except the VD, which causes floaters. But my issue is blurry vision. Like I have Vaseline in my eye. But doctors keep telling me I'm fine. That I need to go back to work. One doctor told me to think about the economy and that I was lucky to have a job right now. So I quit my job. I still want to see out of my right eye, but none of the doctors are taking me seriously. I had a 360 testicular torsion and a doc thought I just had some inflamed glands due to my reactions. Luckily I came back after they sent me home or I would have lost my ball. My favorite thing about this thread is that half of the "here's how you know they're faking" comments get responses that are all, yeah, about that. Let me tell you how that assumption fucked me over and I almost died. I don't know why anyone would want to fake anything medical. Unconsciousness in particular. I got a compound fracture recently and called 911 on myself and was put on hold. Fun stuff. But got through and asked them to send help. Operator was a badass and kept asking me questions to keep me conscious. The ambulance folks arrive. Casually got out of the ambulance. Walk up to me and then saw the bone sticking out of my body. And said, quote, oh, you're actually hurt. Quote, yes. Did you think I called 911 because I spilled some lemonade? Then it occurred to me that most of their calls must be horse shit. But to cause me even more confusion, I received close to a $2,000 bill for the privilege of actual help and the ride to the hospital. That ludicrous bill is no fault of the M's. I'm very much appreciative of their existence and they don't get nearly enough credit, but the best part of receiving that bill? The ambulance ride was roughly $1,850. The fentanyl they gave me was $2.15. When I had a stroke 10 months ago, my biggest fear was I was somehow faking it and the ambulance ride was a sham, and why was I doing it? No, it turns out I was having a stroke. I was so worried I was being a faker, although I have never done that before. Just a really odd mental state. I'm a nurse on a floor that deals with a lot of chronic and acute pain patients. Most recent instance was this lady from a few weeks ago that was apparently splitting the oxycodone. We were giving her in half in her mouth, and then when the nurses' backs were turned, she would stuff it in a pill jar. A night nurse caught her in the act and all of her shit had to be searched. We found 20 half tablets of oxycodone she had been stashing. She told us that she was saving them for her family in case they need them because it's just so hard to get an oxycodone prescription these days. I had her a few days after that, and she was having some abdominal pain. Stat X-ray showed only gas. She just really needed to fart. But she was screaming, claiming it was a 10, and making a huge fucking scene. She demanded Dilaudid throughout her IV, and she wanted it to be pushed fast. Huge red flag right there. She wanted the high, not the relief. Doc straight up said he wouldn't give her Dilaudid because she was already on so many opiates. She then demanded lorazepam, still throughout her IV of course. Doc was like, fine, whatever. Just one time and only a low-end dose. I was flushing her IV with normal saline first, to make sure her IV was patent, and she leans back and is like, ooh, that's so much better already. Hadn't even given her the lorazepam yet. SMDH. My sister is a pediatric audiologist and this is my favorite story of hers. Apparently, sometime in elementary school, usually the early grades, a ton of kids like to fake hearing loss. Like, not just, oh, I can't hear the teacher, full on, wanna get hearing aids, etc. Anyway, she explained to me that based on the way she plays the tones, you can usually tell if someone is faking, especially when they just pretend they can't hear anything. But it's not 100%, obviously, because hearing loss patterns can be really weird. However, she's caught a number of kids simply by saying, okay, so I'm going to play a random number of tones and they'll go in both ears. I want you to say yes if you hear it and no if you don't. I have the reverse. My back went out. Extreme sciatica pain, like being struck by lightning constantly. Couldn't move for days. When someone found me 3 days later, they called 911. Just for the doctor to tell me I was faking it for pain meds. While I was crying in pain, I asked him why I'd lay in a pile of my own piss and shit for 3 days for some Vicodin when I literally own a bar. Fucking insane. Edit. Thank each and every one of you for sharing your stories. As much as I hate hearing them, at least we aren't alone and we know what each other are going through at some level. Actually, I feel much less alone in the world right now, because I've never met someone in my situation before. But they are obviously out there. Brief note for all the student doctors out there. People can pass stroke field tests and still be having a stroke. I could do everything on the list while I had a clot in my brain, verified by CT and MRI, except I couldn't stop vomiting. Good times. Be aware sometimes shit doesn't look like you think it should. Once my doctor accused me of faking to get out of school. I went in with serious stomach issues, and for some reason he decided to tickle me, which instinctually made me fidget and smile. To him that meant I was faking it and he sent me away without checking my actual problem, monsieur. I was grounded and 15 years later, I still have those stomach issues. Fuck you, Dr. Goody. If someone is truly unconscious, their thumb always wiggle. Just say that out loud to yourself. Whenever the symptoms aren't there, when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently, after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild, y'all. One time I was in hospital with decompression sickness and neurological damage and I couldn't piss. I told a nurse I needed a catheter, which she did right away. And I filled 3-liter bags straight off. Anyway, she commented that if a man actually says he needs a long tube pushed up the hole in his penis, then you can be sure he needs it done. Not a doctor but a paramedic. Tons of calls to the jail for inmates with seizures. I lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes and they'll twitch to it. My wife is a doctor and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, "Now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison." While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove their right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. A nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking, telling them I couldn't swallow my own saliva, the nurse just told me, "Yes, you can. This surgery wouldn't have anything to do with your ability to swallow." I could also barely speak, and started crying and pleading with her to believe me. I ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a healthcare professional not believe you during trauma is absolutely scarring. Edit. Clarified that the nurse was the only one not believing me. My surgeon absolutely did. It was scary though, because he actually looked frightened when he finally came in to examine me, like he had never seen this before. Second edit. Answering some questions. 1. Surgeon did believe me, and the conclusion they ended up coming up for the cause was that my nerves must have shut off protectively due to the pressure of the laryngoscope during intubation. 2. We did see a lawyer, but they said it's very hard to pursue legal action in malpractice cases because it's very hard to prove. But regardless, if I recovered, which I did, there is no case. 3. Yes, I realize this doesn't answer the ops question. Just saying that maybe health professionals should be careful when trying to discern if someone is faking it. If they're not, it can be extremely traumatic. 4. Surgery was for an ossifying fibroma in my lower jaw. Had 4 teeth removed and a portion of my jawbone. 5. Thickened water is water with a thickening agent added, usually xanthan gum mixture. When you have damage to those throat muscles, thin liquids are actually the hardest to swallow. I think mostly due to muscle reaction time. My go-to was thick and easy nectar thickness lemon water. You can be faking good too. Had a tooth kicked out, mouth filled with blood and swelling. I'd stuck a tissue in to try to stop the blood. I've presented to the triage at the dental hospital. I'm dribbling blood as I talk. She asks me if it hurts and I said, "A little bit." She looked at me dead in the eye and said, "One of the many things we triage on is pain." Gotcha. Good nurse. Hurts like a motherfucker. I've literally been kicked in the face. Quote, "Thanks for that." Notes taken. Was patched up and out of there within an hour. Edit. Rip inbox. Lol. And thanks for the awards.